Welcome to another episode of Me and My Health Up, where we explore the latest insights and strategies for living a healthier, happier life. I'm your host, Anthony Harcher, a clinical nutritionist and lifestyle medicine specialist. And today we have a very special guest joining us. In this episode, we're thrilled to welcome back Rick Olderman, a world-renowned pain expert who has dedicated his career to helping people live pain-free. Rick will be sharing his expert advice on managing and alleviating pain, offering practical tips and proven techniques that you can start using today. Whether you're dealing with chronic pain or just want to improve your overall well-being, this episode is packed with valuable information that can make a real difference in your life. So sit back, relax, and get ready to learn from one of the best in the field. Let's dive into pain-free living with Rick Olderman. Welcome back on the show, Rick Olderman. How are you?
I'm great, Anthony. How are you?
Fantastic. Really delightful to have you back on the show, and you're the Me and My Health Up pain expert, and I really found our conversation before really insightful. So I'm sure the listeners will love to hear your new insights based on your book, Pain Patterns, right?
Yes, yeah. Just was published on Friday, just a few days ago. So
Wow,
excited to be here.
Hot off the press.
Yes, exactly.
Awesome. I guess the listeners that have just recently joined Me and My Health Up, it'd be great if you could share the background, as you know, your background, your story, just to bring them in the picture.
Sure. I'm a sports and orthopedic physical therapist for over 25 years, and my focus has been on chronic pain. Not because I have any passion for chronic pain, but just because most of my clients ended up coming to me with chronic pain. And so that's what I ended up focusing on, which led me down a long and windy road and led me here to your podcast. Basically, this book came about. This is my 9th book. And this book came about because I have also created a practitioner's training program. And I wrote a 10-page neurophysiology paper in that practitioner's training program. And I pulled that out because no one ever comments on it. So I thought, you know what, maybe I'm going to pull that out and maybe make a little booklet out of this or something. And then I kept working on it. I'm just like, oh my gosh, I think this is going to be a whole book. So that's how this book came about.
Wow, congratulations on 9 books. That's a terrific feat, and it really goes to show that you're well and truly an expert in your field in terms of you love what you do. It obviously shows. I mean, so neurophysiology, that's really intriguing for me, the mind-body connection. And I recently read that book, The Body Keeps the Score. And I know a lot of what you do is talk about trauma and, past experiences and how that can really affect pain that someone's experiencing. So I'll probably allow you to, I guess, talk about neurophysical connections and how they relate to pain and talk about that sort of past traumas. And so
The Body Keeps the Score is an amazing book. I loved reading it. And you had mentioned, the mind-body connection. And that's, we all talk and have heard about the mind-body connection, but there's no one who has put forth a pathway of how the mind connects to the body to create pain. And that's it's not the major theme of my book, but that's one of the things that came out of my book is I put forth a vehicle by which the mind can cause pain in the body. And so it's not this esoteric thing. It's a real connection. It's a real process of how this happens. So we can go down that road if you want to, but that involves more about fascia, a little understanding of fascia and how that works in certain types of fascia called myofibroblasts. And then, as a clinician, I've seen a few patients where, I've been working on them manually, and suddenly they bring up a trauma that happened in their life. And, they don't understand why that happened. And I've learned to just go with the flow with that. But I believe, trauma can can occur in the body physically, be manifested physically in the body through this process by which this fascia becomes contracted. I hate to go into too much detail because it gets pretty technical, but it is in the book. But I just found that is a very real phenomenon that occurs in the body, and that's one of the ways that chronic pain occurs is through stress, anxiety, trauma, things like that. If you go to a bookstore, you'll see lots of books on the body and the mind and so forth, but few of them actually put forth the way that it actually works. So this book is called Pain Patterns, and I identify 3 primary pain patterns that occur in the body that is behind what seems to be almost all spinal pain. And so there's 3 elements of these 3 patterns, and the 3 elements are movement habits, fascial structure, and then neurological reflex patterns that we're born with. And so researchers tend to stay in their own little silos of research, right? And they rarely go outside these silos. But because I've been working with chronic pain, and I continually am looking for the answers to people's chronic pain, it's caused me to move from movement and then onto fascia to understand fascia, and then finally onto these neurological reflex patterns too. And so what I've done basically, Anthony, is I've seen what the commonalities are between these 3 silos of information, and they all 3 identify the same 3 patterns of problems. So I've just simply put all 3 of these patterns together to look at them from all 3 perspectives at once. And I describe how that's done in the book. We can go into that kind of detail if you want to.
Yeah, absolutely. I'm really keen to better understand each of the 3 and how they're interlinked and what we can do about it.
Yeah, sure. So one of the patterns is called an extension pattern. And that basically means, for those of you who are just listening, and I'm holding up a skeleton, so you might want to go to the video to watch this. But basically, an extension pattern means that our back is too arched. And so if we can flatten the spine a little bit, it relieves our pain. And there's a simple test for figuring that out. I may have even done it on your show last time. I'm not sure. And so anyway, this basic posture strategy that we have, where if the back is too arched, it causes us pain, is called an extension pattern because this is extension. The opposite of this also causes pain if it's excessive, and that is a flexion pattern. So we've already covered 2 of the 3 pain patterns, Anthony. So you're either an extension or you're a flexion, all right? And the third is called a side bending pattern, where one side of the pelvis is higher, and usually the same side rib cage is lower. And you can imagine that if you have one pelvis higher and that same side rib cage lower, that you're side bent to the side, and that's why I call it a side bending pattern. And this typically causes one-sided back pain or one-sided sciatic pain or SI joint pain. So you can either have an extension pattern and a side bending pattern, or a flexion pattern and a side bending pattern, but you typically can't have all 3 at once because the extension and flexion are 2 opposite patterns. So I'll just talk about the extension pattern really briefly here. So from a movement standpoint, Dr. Shirley Sarman studied movement and pain, and she identified movement impairment syndromes. And one of them is simply that our back remains too arched, for instance, when we're bending over at the kitchen sink to wash dishes, or we're brushing our teeth, or things like that. We don't tend to relax the spine, and so it stays in this arched position. You can imagine, like, if you're doing a lot of deadlifts on the ground, your back is arched a lot, but people keep that same position even when they pick up light things off the ground. And so this arched position is called an extension problem pattern of movement. Well, Thomas Myers, in his book Anatomy Trains, he's a fascial researcher, and he identified that we have this thing called a superficial backline of fascia, which is a super highway of fascia, basically, that goes from the top of the head to the bottom of the feet along the back. And you can imagine fascia is like connective tissue, and it interweaves, and it's deeply integrated into our muscles. So you can't really talk about fascia without talking about muscles, and you can't talk about muscles without talking about fascia. So you can imagine if we have this line of muscles and fascia along our whole back side of our spine, if it contracts, it's going to cause the spine to arch. And so that's one of the components of a movement pattern problem, is the fascia contraction in that line. And then from a neurological standpoint, when we're born, we're born with these deep neurological reflexes that allow us to grow and develop as we age. And one of those is the Landau reflex. And so if we're crawling on the ground and we want to lift our head to see where we're going, we tap into that Landau reflex pattern, which causes our back to arch and our neck to arch too in order to look up. And then we further use this to stand up tall when we're walking. Well, you can imagine the Landau reflex pattern involves these spinal muscles, the same spinal muscles that are found in the superficial back line of fascia, and the same spinal muscles that are causing our back to remain arched when we're bending over. So this is what I mean when I talk about 3 different areas of research: neurological reflex patterns, fascia, and movement. All are integrated into our body in this way. And so we need to look at pain from all 3 of these events happening rather than just one, either fascia or movement or neurological issues. So that's what I'm talking about in this book.
Fantastic. It's a terrific insight. You mentioned that when we wash the dishes, we get into a particular, a bent motion, and you're saying what we don't do is then relax our back to take us out of that state, and then therefore we carry that state with us. And you mentioned also the deadlifts, you've got that arc, and you maintain that sort of arc lifting anything. And so you said the key was to relax the nervous system after doing some motion or some intense exercise or whatever. So how do you go about doing that relaxation?
Yeah, so Anthony, why don't you visualize, if you're at the kitchen sink, visualize you standing at the kitchen sink and
Yep.
washing and bending over to wash dishes. All right.
Yep.
So in that visualization, what I want you to do is look down at your feet. What are your feet doing right now? Are they in parallel, or is one in front of the other?
No, they're probably more likely parallel.
Exactly.
Yeah.
So this is how most people will do it. So when their feet are in parallel and you start to bend over, what happens is your knees lock in a straight position. Well, now when your knees lock backwards like that, you've taken your legs out of the equation of bending forward, right? So now you have to maintain that bend forward with the arch of your back. And so by the fact that your feet are in parallel and your knees are locking, it forces you into that extension pattern of bending forward at the sink. Now, if we simply stagger our feet and put one foot and put our weight on the forward foot a little bit more, you can imagine, if you can visualize this, that your knee will automatically bend when that happens. And so now when you bend forward, your leg gets to absorb a lot of that stress rather than it going just to that L5-S1 junction between your pelvis and spine. So this is what I'm talking about in terms of movement habits, feeding these patterns. And so when I say relax the spine, I'm not saying relax your nervous system. I'm talking about changing how you're doing something to relax your body.
Okay.
So by just simply putting one foot forward and unlocking that knee, it now has relaxed your back out of that extension pattern. Does that make sense?
It does, totally. And then I'm just thinking now to the deadlifts. That's typically done with parallel feet. So I'm just interested in your point of view around doing, I guess, deadlifts and yeah.
So if you have an extension pattern of behind your back pain or sciatic pain, then deadlifting won't be the exercise that you should probably do to get over that, because we need to break up that pattern, right? And deadlifts feed into that pattern. Now, of course, your feet need to be in parallel when you're doing a really heavy lift like a deadlift. But the problem is that what happens when you bend down to pick up a sock? Most people are bending down to pick up a sock like they would a deadlift, right? So they've trained their body to keep that same pattern of lifting, even when they don't need that pattern of lifting. And they're not aware that that pattern is what's feeding their pain. And so what you would just simply do is just what we did at the kitchen sink: stagger your feet to bend down to the floor to pick up that sock instead of doing it deadlift style. And what this does is it breaks up your whole motor planning of how you're doing things, and it will introduce suppleness throughout more of your vertebra and hip joints and knee joints and ankle joints to lift up that sock rather than just hinging from your back to lift up that sock. Does that make sense?
Totally makes great sense. I'm just thinking in terms of our everyday movement and habits around movement. What are the big ones that stand out for you? Obviously, you've mentioned that cleaning the dishes and things like that. What are
Sure.
some of the other movements that we do every day that you notice problematic in relation to pain?
Yeah, well, if you go to almost any doctor with back pain and or physical therapist or chiropractor, they'll tell you to start walking more. Walking is good for you. Well, not if you're walking incorrectly. If you're walking incorrectly, that's actually feeding your pain and you're deepening the pattern that is causing your pain. What's one of the most common problems that happens with walking? Well, we mentioned it with standing at the kitchen sink. It's locking the knees. Most people lock their knees when they walk, which turns off their gluteal muscles. Then they don't have good pelvic control, which means everything goes to the lumbar spine instead of the pelvis. And so, one of the reasons that people are locking their knees when they're walking is because they wear thick soled shoes that allow them to have a really strong heel strike. And when that foot goes out in front of you, when you heel strike, when you walk, it automatically locks the knee, turning off the gluteal muscles. Well, now you've lost all of your pelvic control as your body is going over your leg. And so you're left with this extension pattern when you go over that. Does that make sense?
It does, and I'm just thinking, like shoes aren't really serving us well. I mean,
No, and if you don't know whether this is happening in you, I mean, the easy thing to do would be to, walk around the block with your shoes on, and then, especially if your sidewalk is concrete, walk around the block with your shoes off, and you'll notice that you instantly have to walk differently when your shoes are off.
oh
And
wow,
this is showing you how much your shoes are affecting your gait pattern, which is then affecting your back
yeah,
or
wow.
sciatic pain or SI joint pain or whatever. Walking is the central behavior, it seems, to almost all lower body pain, back pain, and pelvic pain is improper walking patterns. Because that's the thing that we do most during the day.
And it's true. We've grown up with shoes as well. So
Exactly.
for the moment we start walking, parents are putting shoes on kids, and
Exactly. Yeah.
yeah, so we're not walking around barefoot.
Yeah. And so if
Yeah,
you're walking incorrectly, and especially if you said, well, and your doctor said, well, you just need to walk more. Okay, so if you're walking 10,000 steps a day, now that's 10,000 little hammers that's hammering on your back with every step that you take, right? The key is not more walking, the key is walking correctly. So that's just that. It's things like that, Anthony, standing at the kitchen sink, picking up things off the floor. Those aren't the only things. I have other, exercises in my book, and I have, tests in the book to test where these problems are that you need to fix. And I give you recommendations on how to fix them, either exercises or habit corrections. But it's these little insidious things that are our subconscious programming of how we move. We've just adopted these ways of movement, and we were unaware of the long-term effects on our body because of this. So I'm just kind of bringing this to light in the book that usually these dysfunctional movement habits create these three fundamental pain patterns. You first test for your pain pattern. Once you understand that, then you understand how these other problems are feeding that pattern of pain. It's really simple.
yeah. I was just thinking in terms of you mentioned the fascia, and I assume the fascia is quite responsive to stress, right? Like so, when we're under stress, and I'm thinking of the modern lifestyle, which is quite stressful, and and there's
Yes.
not much relaxation. That's constantly pushing forward, chasing goals, chasing success, and there's very little attention put to, I guess, just being and relaxing and enjoying life. So I just that I guess connection between stress and fascia tension. You could,
Yes.
yeah,
So fascia, for those who aren't aware of it, fascia is connective tissue in our body. It holds everything in place. If we were going to get rid of all structures except fascia, we would look exactly the same because it's integrated into everything. And so there's a certain type of, and fascia is, it is consistent with the deepest muscular cells of our body. So you literally cannot look at a piece of muscle without finding a piece of fascia surrounding it, and affecting it in some way. But there is a certain type of fascia that has a higher contractile property than regular fascia. It's called myofibroblasts. Myo means muscle, so it contracts like a muscle. In fact, myofibroblasts contract up to 6 times more than regular fascia. Myofibroblasts are laid down in areas of mechanical stress in the body. If we look at the spine, just because we have curves built into our spine, where those curves change direction are natural mechanical stress points in our bodies. So there's a lot of myofibroblasts laid down in the thoracolumbar area, which is the lower back area of our body, because the junction of the pelvis and the spine create an automatic mechanical stress point in our body, the junction of L5 and S1. And so we have more myofibroblasts in that region. And so what happens is that unlike muscles, like for instance, if I wanted to bend my arm, my brain would tell my biceps muscle to contract. It would bend my arm. Then my brain would tell my muscle to relax. And so I can straighten my arm. But myofibroblasts don't respond to nerves like that. That's a neural connection. Myofibroblasts respond to something called cytokines, which circulate in our bloodstream like a hormone. And when we're stressed, we release this particular cytokine called transforming growth factor beta 1, circulates through our blood system, finds the myofibroblasts and causes them to contract. So here's the really interesting thing to think about is that our brain may tell our back muscles to stop contracting, but because those cytokines are continually circulating in our body because we're anxious, stressed, or have experienced trauma, it's a never-ending source of causing the myofibroblasts to contract. And so the myofibroblasts may have a longer ramp-up time to contract than a regular neurologically contracted muscle. And it also has a longer tail to stop contracting because it's not responding to neural input. And so we may feel like we're perfectly relaxed, but because we have these cytokines circulating in our bloodstream, the myofibroblasts may not ever relax. And so myofibroblasts they can't do things like bend our elbow like our muscle does. But what they can do is affect generally the dynamics of an area. They can just increase the tension that's experienced in an area. And so that's how the mind can affect the body directly.
Incredible. I was just thinking about how you mentioned earlier, doctors will typically say, need to move more, need to walk more. We have this sedentary lifestyle. And so there's that saying that goes that smoking or sitting is the new smoking. And I was thinking in terms of, what you're mentioning, like that seated position, and depending on how you're seated and for how long will have a real big bearing on, I guess, this cytokine stress around a particular area.
Absolutely. Yeah, it could be, if you have a job that you're doing the same mechanical movement again and again, then, that creates stress in the body because the body likes variety. So does the brain. And so if we're doing the same thing again and again, we develop a stronger neural pattern around that movement and behavior. And so muscles stop turning off around that behavior. And so, muscles as well as fascia may remain on and therefore affect other movements that are outside those particular movement habits. And that's where we often get in trouble is when we try something new and we hurt our back. And it's because we've been doing something the same way for so long. And we only have one neural program that's telling us how to do that one thing. We don't have a program that tells us how to swing a bat, or do yoga poses or whatever, So that involves new learning. And so that's often why we get into trouble with old habits.
And so with these old habits, the repetitive movements, how often should we take, like, what's the frequency that we should take breaks, and for how long, in order to allow the body to relax or turn off that muscle and give it a bit of time to, I guess, de-stress?
I don't look at it as needing to take breaks. I look at it as needing to understand the pattern of movement that's causing your pain and changing that. So I don't want to take people out of a job, right? Because if I say, oh, you have to take a break every 5 minutes, your supervisor is not going to be very happy with that, right? So the idea really is to understand if what you're doing is creating your pain, and then think about different ways to do that same behavior. So the interesting thing is, this is a little test I have in my book. Your brain will not like this. And so here's a little test to show you how much your brain will not like this. So Anthony, go ahead and clasp your fingers together as if brain. All right. Now look at which thumb and finger is on top. Which one?
So I've got my left over my right thumb. So left thumb's over right thumb.
Okay. So now, without looking at your hands, unclasp your hands, and now reclasp them with your right thumb on top of your left instead of the left on top of your right.
Yep.
And now look down and make sure that you did that correctly.
Yep.
Okay, now we're going to keep our hands like this for just a little bit. That feels weird, doesn't it?
Yeah, it does. It does feel
So this
weird.
is what your brain is going to experience when you try to do something different. And there's another signal from your brain that says, this isn't right? If we keep holding this, you're going to start getting annoyed. So your brain is going to create an emotional response to a difference in how you're clasping your fingers. You're going to get frustrated, annoyed, and you're going to say, forget this stupid little test. I'm just going to do it my old way, right? And so this is what happens with the brain. You can unclasp your fingers now. So this is what happens when you change how you're doing something, even if it's better for you. Your brain was going to set off these alarm signals and say, whoa, 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 whoa. This isn't how we agreed that we would be doing this. Now you're changing this up, and I'm telling you, I don't like this. But your brain doesn't know yet whether that new way of doing things is better for you or not. It's just telling you that it's different. So when you change up, if you work at a an assembly line in a factory, or sitting at your office, in your chair, if you change something about how you're doing something, expect your brain to complain a little bit. But you need to work through that and see whether that change is actually going to cause you less pain. Once it does, then you can convince your brain, oh, I need to do this. And your brain will create a new paradigm around that behavior.
Wow. It's that, that really thing around that we resist habit change, and, we typically want to go back to the old way of doing things as opposed to the new way, but we need to be convinced that the new way is a better way and better for us. So in terms of when you're working with your client, you keep mentioning that you identify whether that pattern is causing the pain. So the first thing is, I guess, troubleshooting as to what pattern that this person does on a daily, regular basis that is driving the pain signals to their brain. And so once you've identified that pattern, are you looking to rebalance the body and bring in other muscles and to better support the overall activity that they're doing that's driving the pain? How do you then go work with the client to go about rewiring, so to speak, the pain pattern?
Yeah. Great question. So the first step is identifying the pain pattern that you have. And then the next step is figuring out why. All right. And that's where a lot of the tests in the book is, they take you through a lot of the tests that most practitioners don't think to ask you to do, because they don't believe that these could be linked to your pain. And this is because of how we're trained. We're trained in component thinking in medicine, not systems thinking in medicine. And so if you understand, let's say that you found that you have an extension problem behind your pain. All right. And then you go through these 8 or 10 tests, and you realize that, oh, I've got this problem, I'm locking my knees and so forth, then you can say, oh, once I fix these, all of these will then change my extension problem pattern, right? And so that's why it's important to understand why the pattern behind your pain first, so you understand. It'll help you identify how that particular problem is feeding that pattern. And that's how I do it. Pattern first, then we go through the rest of the tests to see what is feeding that pattern. We change those things, and that decreases the pattern, right? Just like when you stand and you stop locking your knees, your back won't arch as much. And so that really reduces back pain. It's as simple as that. And this is one of the things that, I've taught this to my therapists in my clinic, and their response is that while it's a more comprehensive way of thinking, it's much simpler. So solving back pain has become much simpler than most people think, because most people have been to practitioners and they say, well, let's try these 50 things, and okay, well, I've got 50 more that you can try. And this is what I always tell physical therapists when I'm talking to them. Wouldn't it be better to know whether something's going to work first before you give it to your client, rather than trying to guess and keep trying things? And so, but a lot of them don't believe that that's possible because of our training. Our training is in breaking the body into these little components rather than understanding things from a system.
Yeah, wow. It's a great way of looking. So you take that more broader perspective of the human body, that more whole, because as you've mentioned, there's so many factors that influence pain that you need to take a broader perspective. Otherwise, you get too narrow-sighted and really don't address the root cause. And I think the other thing that you're sharing is that when you actually just have a stab in the dark or just try multiple things, that the client will just eventually give up if you're not getting it quick enough. And so then they essentially think, oh, there's nothing that can help me, and therefore I'll just keep taking painkillers and whatnot. Whereas what you're saying is, if you really get down to that underlying root cause, you can find that corrective solution that will give them a quicker outcome.
Yeah, I just helped this woman with sciatic pain. She's had it for months and months, has been to a ton of practitioners. I had one telehealth session with her, and her pain is almost gone.
Yeah, wow.
So I didn't even have to touch her. And so understanding how the body works as a system is so much more impactful, because you get to understand, the lever arms and these big hammers that are pounding those vulnerable tissues, rather than just the little mechanics of every little tiny thing right in there, right? And so, and frankly, my dad, as a matter of fact, he's been wrestling with sciatic pain for probably 8 months now. And I just went and visited him, and he said his pain is almost gone just after a couple of days of doing what I've asked him to do, because I could instantly see where the pattern was that he had. And then I found the one thing that was causing that pattern to occur. And so it can be that simple. It's not always that simple, but it can be that simple. Even if you've had pain for decades, it can be a simple thing.
And what are some other misconceptions, myths that really frustrate you, given your area, your knowledge that you've accumulated over the years? And obviously, you've gone on your own journey to discovering what works really effectively and quickly. What are some of the other ones out there that really frustrate you? You mentioned the one about doctors saying, just walk more, and the pain will dissipate or go away. What are some of the other ones that you just get so frustrated about?
Well, core strength is a big myth in terms of back pain too. That one is pushed a lot by almost all areas of medicine and health. I never work on core strength, because the lever arms of your legs exert much more force to your spine than lack of core strength could. And so this is what I found with a lot of therapists anyway, is that, they'll give you a core strengthening program, but the core strengthening program is feeding the pattern like bridging. Let's say you have an extension problem with too much arching of your back, and you're given a bridging exercise, which is lying on your back and lifting your hips up in the air. Well, that's creating extension in your back, right? And so just doing that exercise is promoting the pain pattern. No matter, you can do 1,000 sit-ups a day. It's never going to stop your behavior of arching your back. And this is what I found, is that a lot of therapists will blame the patient. Oh, you still have back pain? Oh, you must not be doing enough core. Here's your 10th core exercise. The other 9 weren't specific enough. Here's a 10th, right? And it just doesn't help with most chronic back pain because the pattern hasn't been identified. And often those exercises are actually feeding the pattern, causing pain in the first place.
Yeah, wow. And I was just thinking, as you're sharing that, I have a background in running, and I think, I started to develop some lower back issues, road running. And I'm thinking, well, I used to very much do that heel toe sort of running style. And I was just wondering how much that would have contributed to the lower back issues that I was having.
This is a great question, Anthony, because a lot of runners with back pain like you will think it's their running style. And if you think about running, when you're landing, your ankle is flexed, your knee is flexed, you're slightly over your leg when you're running, your glutes are getting turned on, everything's getting turned on. So running usually isn't the cause of back pain, unless you're just running road running, straight road running. That usually keeps your back in an extended position. But trail running, going up and down hills, that allows your back to move in and out of flexion and extension. However, the real problem that's causing the back is, percentage-wise, how much of your day is spent running? Maybe 1 or 2%.
Yeah.
All right. So you're going to forget the other 98% of things you're doing throughout the day, right?
Yeah.
So usually the problem with runners is not how they're running, it's how they're walking.
Right.
It's everything they're doing leading up to the run that is the problem, not the run itself.
Yeah. Wow. Yeah. So certainly not addressing, that's like thinking that the problem is the tip of the iceberg, isn't it? Yeah. As opposed,
exactly.
Yeah. Okay. Wow. Such great insight, Rick. Is there anything that we haven't covered that you thought, oh, Anthony, you should have asked this?
Well, we've kind of danced around this through our talk together, but in the book, I also introduced this idea of functional linking. And what I mean by that is how to discover older injuries that are likely linked to your current pain. And this is one of the things that I feel most practitioners don't seem to understand, is how that link process is happening through the body. And so this book helps you figure that out, how this problem is linking to cause your old pain. Instead of thinking your back pain is just from something that's happening in your back or weak core strength, well, what if it was due to plantar fasciitis in your left foot that you had 15 years ago that has resolved since then? So there's so many older things that we have done to our bodies that our brain has compensated around so that it's not painful anymore. And therefore we think, oh, I'm working perfectly. No, if you're not in pain right now, it doesn't mean that you're working perfectly. It just means that your brain has compensated to a point that you're not hurting. So these things catch up with us eventually. And so my book that's the big thing from this book, is that, I'm talking about back pain and sciatic pain, but I go all the way down into the foot to test those areas, to show you where these problems are likely in your body that you haven't really noticed before, because your brain's been so good at, getting you from A to B, and figuring out and compensating, figuring out a way to compensate to get there. So that would be the last thing, to mention, I think.
The functional linking and the fact that your pain could be due to an old injury, is that in essence
almost always the case, Anthony?
Right.
And I'll tell you, I can't remember every patient I talk to, what are your older injuries? I don't have any older injuries. What? You're a marathon runner and you've got no older injuries? Yeah, no, I've never had any pain ever. I'm just like, oh, okay. And so I go through the exam and I find these deficiencies. And I said, why are you having this? Oh, that reminds me of this one time I used to sprain my ankle a lot, but that hasn't hurt me in 30 years. No, that counts too. Anything else? And then that, the whole floodgates are open at that point. You mean that kind of stuff matters? Yes, everything matters. And this goes back to your original comment, the body keeps the score. So he was talking about trauma, and this is a different kind of trauma, all these little older traumas that you've had throughout your body, your body is keeping the score, and your current pain isn't due to just a whim. It's due to some old pattern or habit or injury that you've been compensating around likely for a long, long, long time.
Okay. And it's just that is now catching up with the person?
Yes,
is that
exactly. It's feeding one of three pain patterns or two of three pain patterns.
Right. Okay.
Yeah.
Fantastic. Well, I really appreciate you coming on and sharing the latest pain information, and also giving some insights into your newly released book, Pain Patterns. And so how can the listeners best connect with you and get a copy of this great book?
Yeah, so this is the tricky thing, is the book is printed in color, but I've just found out, Anthony, that Amazon does not have color printing in Australia. I don't know why. So, I'm not sure how Australians can get the book. I'm hoping that if they use a different Amazon distributor other than Australian Amazon, that they can get the book. So, it's a good question. Anywhere else in the world, you can get the book in color, but for some reason, Australia's Amazon printing division doesn't have color printing.
Oh, we're just a bit behind. We'll catch up, I'm sure.
Yeah, well, yeah. I sure hope so.
Yeah,
it's important information. So, I hate to leave you hanging like that, but really, maybe if you could order from a different Amazon distributor other than Australian Amazon, you can get a copy then.
Yeah, and the great thing is I've got UK listeners and US listeners, so they're right. It's just the Aussies that need to log in.
It's the oddest thing.
Yeah. Wow. Well, I'm sure they'll find a way.
Yes.
Yeah.
Australians are very inventive and resourceful.
And I'll certainly share can you buy it on your website?
Well, my website links to Amazon in the U.S.
Yeah.
So it would be a really good, it would be an interesting experiment to see if Amazon U.S. will ship to Australia.
Okay, so listeners, please share your comments and feedback as to whether you've been able to purchase Rick Olderman's Pain Patterns book via Australia.
And then one more thing, Anthony, all the tests and exercises come as videos. So those are found on my website with a code found in the book. So, it's not just pictures. I have videos because I find that that's more meaningful for people if they can watch a test being done.
Absolutely. Yeah. And we're big video consumers, hence why you'll find this podcast on YouTube and Spotify. And I really want to thank you, Rick Olderman, for coming on and sharing the latest insights on pain. It's been terrific. I've learned a lot. So thank you.
Thank you, Anthony, so much.
And thank you, listeners, for tuning in to another insightful episode of Me&my Health Up. If you know of anyone that's suffering from chronic pain, please share this episode with them. It can really help direct them to finding an answer, a solution. So please share the episode with anyone you know that is suffering from chronic pain. They don't need to suffer anymore. They just need to read Rick Olderman's book. So thank you, Rick.
My pleasure. Thank you.
You're welcome. Podcast disclaimer. This podcast and any information, advice, opinions, or statements within it do not constitute medical, healthcare, or professional advice and are provided for general information purposes only. All care is taken in the preparation of the information in this podcast. Connected Wellness Proprietary Limited, operating under the brand Me&my Health Up, does not make any representations or give any warranties about its accuracy, reliability, completeness, or suitability for any particular purpose. This podcast and any information, advice, opinions, or statements within it are not to be used as a substitute for professional, medical, psychological, psychiatric, or any other mental health care or healthcare in general. Me&my Health Up recommends you seek the advice of a doctor or qualified health provider with any questions you may have regarding a medical condition. Inform your doctor of any changes that you may to your lifestyle and discuss these with your doctor.
Do not disregard medical advice or delay visiting a medical professional because of something you hear in this podcast. This podcast has been carefully prepared on the basis of current information. Changes in circumstances after publication may affect the accuracy of this information. To the maximum extent permitted by the law, me&my Health disclaims any such representations or warranties to the completeness, accuracy, merchantability, or fitness for purpose of this podcast and will not be liable for any expenses, losses, damages incurred, indirect or consequential damages or costs that may be incurred as a result of the information being inaccurate or incomplete in any way and for any reason. No part of this podcast can be reproduced, redistributed, published, copied, or duplicated in a form without prior permission of me&my Health.